Welcome to another episode of Moments with Nyengeterai. Thank you for coming back to the channel. I just want to say thank you again for the views, for those who subscribed, and also obviously the ones who are liking and sharing. Please continue to like, to share. I truly believe in the power of stories from other people that help us to heal, to grow, to be inspired, to transform our own lives. So that's the idea of Moments. And today I have a very, very exciting guest, Dr. Pai. Dr. Pai, welcome.
Thank you, Nyengi.
It's a pleasure having you here. And thank you for coming through. So I know you as Dr. Pai. I know who you are and what you do. Can you briefly tell our guests who Dr. Pai is? And
that's always a hard one because you always want to say the politically correct answer. So maybe let me just say what I really feel and who Dr. Pai is at this moment. I think Dr. Pai is a loved and honored woman. Despite the things I physically and the titles I physically have, like I am a doctor, I'm a dentist by profession. I am a wife and a mother of 3, a sister to many. I have a lot of siblings and I love them. But I think in this moment in time, I am a woman who knows her maker. So I feel loved, I feel seen, I feel heard, not by people, but by God. So that's who I am in this moment. And I think we change. Who we are changes in moments, in situations. So I hope that answers you, because I always find that's very difficult. We're always told, don't tell us what you do, tell us who you are.
Who you are.
And who I am, like personally, other than that, is I think I'm still writing that book. I'm still trying to find it out myself. So I am a woman in the making, I guess. That's what I can say for now.
For now. A woman who's evolving.
A woman who's evolving, yes. A woman who's evolving. A woman who is finding herself. I thought I knew myself, only to find out I don't. So now I am in the process of finding who I am, what I'm all about. I think I'm still trying to find the answer to that question. But what I definitely know is I'm a woman who is loved, who is honored, who is seen.
Wow, I love that. That is so powerful, and I'm going to actually start there.
Okay.
When you talk about, you said you are a woman who's being seen and who's loved, and you spoke about your spirituality. Let's start there.
Okay.
Talk to me about your spirituality. When did you discover? Like, when did you? I can't say discover God.
Yeah.
When did you have that relationship? Because I think throughout our life, we have moments where we say we've discovered God, or we are Christians or whatever. But I think our relationship changes over time. But talk to me about where you are right now and what that relationship is like and how you came to that relationship with God.
Wow. So I think I always say I am in therapy with God. That I have God as my therapist in this season. And it started, surprisingly, 2021. It's hard to say when my spirituality started, because it started way back. I think when I was still at uni. But sometimes your journey starts and you don't even know it. But I was at uni. I knew who God is. I was aware of who God is. I did go to church. I mean, I grew up Catholic. And as I grew up, crossed over to the Pentecostal side. And I had moments, like you're saying, you have moments. I think God manifests to us differently depending on the situation you're in. So I've had God being there as a father, has God being there as a provider. But in the now, I think I say, truly, truly, God is my therapist. The Holy Spirit is my therapist. I am in God's therapy because of what happened to me in the past. In 2021 when I gave birth. And I say that's my big testimony for now. I have so many others in the back. And I think each and every testimony has its purpose and its reason in your life. But the one I'm experiencing now comes from what happened to me when I gave birth to my last baby.
So let's do this. Let's actually start I know I wanted us to start at the relationship, but I think now that you've put everything into context and where you're at this space with your relationship with God, let's start at what happened in 2021 that now got you to where you are with your relationship with your maker. Let's start what happened, what you went through when you were pregnant with your daughter.
Yeah. So my children have been interesting how they come. The first one, she came in 2014 and I had fibroids. So she was in a little corner. She couldn't move. I had been told, look, we're going to be lucky if you actually hold the child. The fibroids started bleeding. It was dramatic. I was on bed rest for 6 months. That ended. I thought, okay, I have my baby. Let's do this. Had my second one. Regular gynae visit. They can't hear a heartbeat. I had to have a C-section. Okay, I thought, okay, motherhood, this is tough. Okay. I think I'm done. I said to my husband was saying, we are no longer having children because we have not had a proper experience where it's you do the, hold your hands, it's smooth sailing. It's been an emotional roller coaster. So we were like, you know what? We're done. So I was, taking precautions not to have kids and everything else. But my period stopped. It just stopped. And, first month you're like, okay. Second month, okay. Third, okay. Fourth, I know. I'm a doctor. I should have known better. But I'm also a woman at heart. I said, maybe early menopause. So I stopped. Being careful. I don't know why, but I just stopped. And I thought, with no period, I'm not going to have a baby. 6 months down, 7, 8. But something started going on. I started feeling weird. I started not feeling myself. Took a pregnancy test. Just like, oddball, let me check. Came out negative. Went another 3 months. Thought, still was, something is not right. Finally took a test. Found out I was expecting.
You're doing this test by yourself at home.
I was doing this test at home.
Yeah.
We're doctors, so I wasn't exactly looking for someone else. I just thought, And I couldn't believe it, so I said, let me do a blood test. And this is just me doing it by myself. I haven't told my husband. And then I found out, I am pregnant. So I told my husband, and he just looked at me and says, dude. I was like, it is what it is. We're expecting. And not only are we expecting, only to find out I was already 5 months pregnant.
What?
Yeah, I was already 5 months pregnant. But because I wasn't in the space of pregnancy, I didn't do the preparation. And I had, in one of my cleansing moments, sold everything that I had for my babies. Because I was saying, I'm done with this chapter. I'm not doing this anymore. So I sold everything, only to find out I was 5 months pregnant. It was hard to accept that I was pregnant. I didn't tell anyone. I think I then told my mom when I was now 6 months, because now it was showing at work. I said absolutely nothing. I remember I told my boss, I think when I was left with a month to go, I sent her a message like this. I knew she wasn't going to read this message. I just sent her a message and thinking, Lord, I hope she doesn't see this because I'm not ready for the questions. Then I sent her. I didn't tell many people. I think I later told my family later on. Because at that time I was doing school. I had so many things going on. I started a great job. I was loving my job, but it was demanding. And I was worried, what does that mean? Do I have to quit? You know how it is. It just came at a wrong time, let's say. Well, retrospectively, at that moment, I thought wrong time, but now,
right time.
God's
time is always right.
God's time, God doesn't make mistakes. And so there I am. And you start thinking in my age, I'm pregnant. But it was what it was. So my office...
But you're not old. Come on.
What? You know how it is like. You'll be like, for my age, I'm past 35. I need to...
No, but I hear you.
So, but with time went, the motherly instinct kicks in. I am a mom. I have to do this. I started talking to the baby, starting preparing for the baby. I was blessed. I found friends in weird places. People started giving me stuff. My sister started saying, okay, what do you need? I mean, not that I solicited them for them. They just, how God will see, this girl is not going to go and buy a pram. So my sister just says, look, I just want to gift you. What do you need? Send your list. I'll send a runner. They'll bring your stuff. So things started happening mentally. Myself and my husband started preparing for this baby, starting to explain and everything else. But the weirdest thing was my office was directly opposite avenues. There was a room. I always used to point at with everyone else. Then I'd say, you know what? I see myself sleeping in that room. I want to go sleep in that room. Should I pretend to have muscle cramps? Should I pretend to be in labor? I'm just feeling I need to go and sleep in that room. And they would laugh and say, what is it? And I don't know what it is, but I think I'm going to sleep in that room. And I'll tell my husband, you see what? I need to go and sleep in avenues. What should we do? Should I say that the baby? Because I have experience from past pregnancies on how you get yourself in avenues or into a hospital. So I'm like, should I say I can't feel the baby kicking? And then he'll be like, dude, don't. And then I said, okay, let's leave that. So the day came, I was going to have C-sections because all my others were C-sections. Everything was fine. Booked ourselves in.
And the pregnancy was normal? Nothing? You didn't have any issues?
Nothing. Nothing. Just a few, maybe my BP got up but nothing. No, let me be honest. Nothing. It was a normal. I was highly energetic. I went to work until the last day. Wow. I loved work. I loved this lady I used to work with. She just used to make me so happy. And people would wonder why. And I would just love her. But again, God has, because this woman was so monumental, she was going to be so monumental for me in the future. So, no, perfect pregnancy. I mean, look, I didn't even feel the first 5 months, except just getting pregnant, the usual, which come with pregnancy, but
that's
nothing.
Fun. So you missed half the pregnancy.
I missed half. No morning sickness. No drama. In fact, no drama for all my pregnancies. So I go in normal. This time, because all the other times I would go under general anesthetic, this time I insisted to my gynae, I want to see my baby. As soon as my baby comes, I want to hold my baby. So we did the halfway, just get anesthetized the bottom. Went in, did that. Saw my baby, took the pictures. She was such a beautiful baby. She was crying. Mother instinct comes. I'm like, you were meant to be. We are here. My husband was with me. Pretty the picture perfect giving birth. And then at that time, nice, sweet. The people were treating me so nicely. The nurses, because, I had complained at some point. You know me. So everything was going perfectly fine. But I was not feeling okay. But I did not tell anyone. Doctor syndrome. In my mind, I diagnosed myself. I told myself what was wrong. I told myself I'm a big lady. I said, look, maybe the anesthetic is still in my fat cells, so I still feel a bit whooshy because of that. So I didn't say anything to anyone. And then my gynae came and said, no, we're discharging you. My husband is the one who said, look, you're being discharged, but you're not yourself. You don't look like it. And then me being me said, no, I'm fine. Let's go. And then he still kept saying, just stay a day. You don't look lucid. You don't sound lucid. You don't look like yourself. Then I said, no, I'm fine. I'm sure it's just being in hospital. Let me go home. And then him being, the nice guy he is, he listened. On our way home. Oh my God.
With the baby.
I was with the baby, in the nursing thing. What I had noticed was my tummy was growing bigger and bigger. But again, I made an excuse. I said, look, I'm a big girl. I just given birth. I didn't tie. So naturally, my tummy is going to be big. On the way home, I could feel every bump. I could feel it's like, Zim is not the smoothest, right? Anytime there was an upset, my stomach, it's like someone was squeezing my stomach. It was horrible. The journey, we're 20 minutes out from the hospital, but it felt like an hour. But here I have the baby, so I keep on saying, and then my husband says, you're moaning. Again, trying to be strong. I said, no, I'm fine. Let's just get home. Well, as soon as I go home, the pain was just now at a 10. I was no longer myself. I couldn't see, I couldn't feel, but I was cognizant that I had a child. So luckily, my mom had already come home. She had said, let me just go and prepare, moms, grandmoms, and go. She said, let me go prepare the other kids so that they know that the baby's coming. Let me talk to them and tell them that. So I didn't know that my husband already told my mom, but Paida is not looking okay. So she had already come just to say, let me, help her out. So the only thing I remember is I could just muster as much strength as I could to hand over my baby. As soon as I handed over the child to my mom, I just let the pain just came through. And the first thing I thought was, let me go and lay down. Couldn't. The pain was just, then I thought, okay, after you have a C-section, some of the time they say it's gas. So you have to go to the toilet. So I forced myself, like, you're crawling. Remember, no one can see me, so I'm crawling to the toilet. I go into the toilet. That's when, I don't know what happened. I don't know. All I could do was take my phone. I called my friend. Being the spiritual person I am, I said, something is wrong. Pray for me. And I passed out.
You passed out?
I passed out on the toilet.
You had crawled to the bathroom?
I crawled to the bathroom, thinking that maybe it's gas. Because now the pain in my stomach is now visibly bigger. And I no longer have to be strong because the baby is in safe hands. So, I always say motherly instinct. I knew this baby. The whole way through, I knew, whatever I do, I still have this baby. But the minute I knew baby's safe is with my mom, I think that defense, that system just went away. And I called my friend from church and I said, something is wrong. Pray for me. And then I passed out. So by the time my husband came and saw me, they carried me onto the bed and they managed to get me conscious. And then he just says, what's happening? We need an ambulance. Then I said, call work. And, I always say I'm blessed. I had made a family at work. And, many people complain about their works and I loved my work. Like I said, it was demanding, but I'd made friends. I'd learned a lot. I developed a lot because of that. So I just said, call work. There's an ambulance. Then I passed out again. So my husband took my phone. Always make your husband know your password. My husband took my phone, called work. I'd given them the name of the person to call, called work. They sent an ambulance. The ambulance comes. They know who I am. They're busy asking me, Dr. Pai, what should we do? And I'm like, I don't know. Just give me a painkiller. I'm in so much pain. In the ambulance again, it's the same. Every bump. I kept on saying, guys, just put your siren. I can't do this. I can't.
What kind of pain were you?
Oh, it's it's like someone was it's taking your balls and twisting, and that expansion. It was, I don't know how to explain, but it was painful. You know how it is like it's past menstrual pain. It's past being. It was painful. And then we go, and then now I'm sweating and I'm losing consciousness, as in I'm losing, because I once drank. So I was like a drunk person, but I'm in pain. But I know I'm not drunk. And everything is swirling. Everything is looking cloudy. It wasn't making sense. You can see people are talking to you, but I'm not consciously, like now I can see that I'm consciously talking to Nyenge. In that moment, I don't know. It's like you are having your life, I'm having my life, but I can see that things are happening. So we get back to the hospital and they were like, oh, since you were already here, we're just going to take you back to the gynae ward because you need to go on a painkiller as soon as possible. So they just sent me back into the gynae ward. I was put on a strong painkiller, Pethidine. Put on a painkiller, and Pethidine makes you woozy. I was already out of it. So this was on Friday. Now this part I will narrate as it was narrated to me because I was out of it. I don't remember. That's the irony.
Wow.
So Friday into Saturday, apparently I was in and out. So people come. I told my mom. Apparently I told my mom, I can't do this. I'm ready to die. Yeah, apparently I told her that this pain, I cannot go through it. I'm trying to be strong, but God, just take me. My apostles and my pastor came, they saw me, same thing. So apparently I was clinging on to the bars of the bed because they're cool. So they're giving me the cool down and I'll cling because of that pain. So this is now Saturday. By Saturday afternoon, I'm not quite sure why. I think I was taken off the pethidine so that at least I was now regaining consciousness and I was now aware of what was happening. And then on Saturday afternoon, late evening, I think when they're giving you supper, I told them I can't eat. It's painful. My stomach is painful. And it was an NSAID. Again, now I love NSAIDs. I'm a doctor, but I love NSAIDs because they're the ones who take care of the patients on the floor. She's like, no, Paida, let me feed you. She was heaven sent. She was feeding, not knowing she's making the situation worse, but in her mind, I haven't eaten in 2 days. I'm weak. I'm in pain. So she fed me and she says, you know what, let's just pray you'll be fine. You know, she kept on saying, you've got kids. I know you've got other kids. Eat. So I got a bit of strength from her words and I ate. Then after eating, the pain just got worse. And you know, you're squeezing that button and you're like, nurse, come. And they were not coming. And then there was another girl who was next to me. She was expecting and she was a young girl. And, you know, she kept on saying, are you okay? Then I said, you know, I'm fine. I'm just in pain. Then I just said, you know what? If I keep on sleeping in this bed, you know, this is me not knowing at some point I'd given up. But when I'm now consciously there, I'm like, I have to fight. You know, remembering what the nurse had said, I have to fight for my kids. I have to get out of this bed. It was painful. I think people who have had C-sections understand. Remember, I had a C-section. Despite all this, all that's happening, I still have a wound for C-section. I said I have to get up. So I got up, you know, holding the beds. My aim was to get to the nurse's station because they were not coming. So I got to the nurse's station and said, look, if you are not... So I'm a very vocal person. My plan in my head was I want to make the most noise I can to force them to act. Because I had not seen a doctor. So in my mind, remember, I haven't seen a doctor from Friday. But the doctors have been coming but I've been spaced out. Yeah. So in this time, I'm saying, where's the doctor? Yeah. It's been a day. So in my mind, I was like, I'm going to make noise. My gynae has to come. My stomach is going big. Now there's a stage where if you touch it, it's painful. So I go to the nurse's station and I said, I'm in pain. And you guys are not doing anything. Remember, I have no recollection that they've been doing that.
Was happening before.
I'm like, let me go. If you cannot help me, let me go. Let me go and find somewhere else to go. I'm going to make noise. I've been beeping. You're not coming. Where's my gynae? Look at my stomach. And then the nurse was like, Paida, you gave birth to Muskana Mombe. And I was like, you know what? I agree with you, but I know myself. This stomach is expanding. This stomach is now painful. I tried to eat. I couldn't eat. Kana musuru down batsira. Let me go. That's when she said, okay, let me call your gynae. And my gynae, I think the nurse was just like, you have to come because this woman she's going crazy. She wants you to come. By this time, I'm sweating. I'm breathing funny. I'm breathing like, but in my mind, I didn't know. I'm only told by people that's how I was breathing. In my mind, I was speaking like this. In my mind, I was actually being a warrior. But the nurse, when you then ask them, they were like, I could hardly speak. I was, you know, gasping. They could see I was determined, but the way I said it. So the gynae comes. I was about to say it, very technical term, but he taps my stomach and you can hear it's hollow. It's full of fluid. He's like, oh my God, we need a gen surge now. Then he's like to the nurses, who's the gen surgeon on duty? They call.
What's a gen surgeon?
A general surgeon is someone who cuts. Sorry. Like we need a general surgeon because we need to cut you. We need to cut you. It's fluid buildup. Remember, I'm a doctor. I know what this means. First thing I say is, what general surgeon this time of night is going to come? Better be someone who doesn't drink.
When the doctor is in the hospital, they know.
I'm listening and he's like, and remember in my mind, I'm this strong, but they're saying I'm doing this, but I'm gasping. I'm like, I can't breathe. I'm sick. But in my mind, I am 100%. So the general surgeon comes and says, we have to go cut. We have to cut her now. But we have to drain
the fluid.
It's too much. We have to drain. The anesthetist will not put you down with this fluid. And they start describing what it is. Remember, I'm a dentist, so I do know some things, but I don't know all things. We have to put a tube in your nose, take it into your belly, and then the water comes, and then we anesthetize you. I'm gonna cut you, take out your bowels, see what's happening, because if there's a leak, the problem is infection. And yeah, that's what we're gonna do. And then I said, okay, fine, do it. Then my gynae, oh bless him, says, oh no, we need to call her husband. This is now like at 11, 12 midnight. So again, I give him my phone. I give him, could I remember my husband's number in that state that I had to, they said I had to, I literally told myself, Paida, relax. Then I managed to say his number. And remember, I'm in pain and I'm grasping and I'm moaning, and they wheel me over to the theater. I am moaning. The pain is just now. It's, you know, the head,
what are you thinking?
Pain, and pain, no pain, yes, sir. Mm-hmm. In my head, I'm just thinking, I need to get this pain away. In my head, I'm thinking, are my kids sleeping? That's what I was thinking. In my head, because I told my guy was like, let me call your husband. And I said, no, let him sleep. There's nothing he's going to change. Let him sleep. He'll come tomorrow morning. He's got the kids. There's a newborn. Let him sleep. Then it's like, no, we can't. Because they were now scared that I would not be able to consent. But I managed to give consent and sign. So my husband says when they call him, the gynae just says, oh, we're taking her to theater. He was so sleepy because he was tired. Remember, they have had a day with the newborn. He just said, okay. And I said, you know what? He felt bad because he thought, like, as a husband, I should have moved. Then I said, no, it's God, because in my heart, I didn't even want you to know. I want you to be sleeping, because what were you going to change? What was he going to change? And I got this. You know, I'm one of those. I got this. I can do this by myself. So we go in. I'm wheeled in. That strength went away. When the lights went out, then I realized I'm by myself. And I'm about to go under by myself. But I have to be strong. And you know what? They always say when you're about to die, you always need to live your life as if you're about to die. Because you don't have time to say magnificent long prayers. You don't have time to say, God, oh, I want you to take care of, oh, I want you to take off this, oh, forgive me for my sins. It's so, all I could say was, holy angels, watch over me. So I say that. And then they do that process. So they bring out this little tiny, something like this, saying we're going to drain, the usual. They put in the anesthetist finally comes. Okay, I say finally, but I heard she came in the right time. To me, it was like a lifetime because we were waiting for her. She finally comes, she puts in the drain, and they drain. Not this little, they had to get a bucket, a 5-liter bucket. That's how.
They started off with a small little glass.
That's what they are used to.
And they put this thing.
They put this thing in and it goes like, splashes them in the whole thing. But the instant relief I get, that pain Nyenge just goes. The minute it hits that tube, they put it through your nose. And they're like, you know what, you're just going to bear it. And I was like, put it. They put it through your nose. And then it goes like, and she's like, oh, we need more things. They were not expecting it like that. And instant relief for me. Instant, the pain goes. So, which means that pain was from pressure of the buildup. And so I say to the gent, said, so you don't have to cut me anymore. And he says, no, but we have to cut you. Because where did this fluid come from? And I said, do what you have to do. And then I said to him, how will I know? The doctor, how will I know that things have, things are good? Then he says, if we put you in ICU, things didn't go as good. With the amount of water that has come out, I don't think you're going back to the general ward. Best is we'll go to HDU. Worst, you go to ICU. Because I told him, give it straight. We are colleagues, just give it straight. Then I said, fine, cut me. Then they cut me. Then the next thing I remember, now from the next 2 days, I'm out of it. But what I remember of the next day, that was the Sunday, I saw ICU. In my, when you've been under general anesthetic, when you come, when you wake. So my doctor said I was one difficult patient because apparently I was fighting the anesthetic. I was fighting the sedation. I always wanted to know what's happening.
What's happening?
Where am I? So remember, I'm sedated. By right, I'm supposed to be drowsy. But I'm looking, because in my mind, I'm looking for either
you or ICU, because he had told you.
By some miracle, General Ward, I saw ICU. And then I passed out. Next thing, I'm seeing my husband, they're around me. And the funny thing of all this, I'm going to tell you, Nyenge, from my perspective, I was fine. I was talking to you like this. I was in no pain. The pain went. The minute that tube hit, the pain went. I was absolutely fine, breathing normally, talking. But when I'm told
what you were doing was totally different.
I was sick. I couldn't talk properly. But to me, I thought
you were talking properly.
I was talking properly. I was showing my true strength as a woman and everything else. So next thing I see my husband, they're doing a tele, like a WhatsApp with everyone, my sisters, everyone, thinking, guys, why are we all doing this?
Why are you not here with me?
And they're just saying it's going to be, everyone is comforting me. But I'm thinking, why?
I'm okay.
I had peace. I had so much peace. But apparently my vitals were off the handle. My heart was failing. My kidneys, everything was just, I was in a bad place. So when my husband comes, he tries to be funny and sneaky and says, no, you're fine. You're not in ICU. Then I said, dude, I'm in ICU. He says, yeah, I see you. You're not okay. Then I said, okay, what does that mean? Then he says, your stats are off the chart. Your heartbeat is up. You have a fever. You're running a fever. Then I said, but did they find anything wrong? Nothing. Your bowels are fine. So I got cut for nothing. But you're sick. Whatever is happening, you are not well. So they've asked that they have a family conference. I'm a doctor. I know what it means to call, when doctors call your family, it means to say, if you want to say goodbye, this is the time. Then I say, okay, where's my brother? So my brother always, my husband always says, if you want to get through to Paida, call her brother. So I say, call my brother. He'll tell me the truth. So my brother comes, but he's not the usual, He's like, relax, Paida. I'm thinking,
relax?
Yeah, he's like, relax, you'll be fine. And I'm thinking, that's not tough.
What's going on?
Then I knew something is wrong. And you know what I did? Started doing? I started passing out my things because I knew I was going to die. Yeah. And I started giving away. I said, okay, Taff, you're here. I need you to be strong. This is what is going to happen.
But as a doctor and you're feeling like, okay, I'm dying. What were you?
I didn't feel it. That's just the irony. I didn't feel like I was dying. I knew I was dying. The doctor knew with what's happening. But with me, I was at peace. To me, I was normal. I was just talking to you. But the doctor said, you are dying. So apparently I started saying, I love yous, my goodbyes, my everything else. And my brother just says, no, I'm not going to listen to that. Stop being funny. I told them, look, I have a Nyaradzo policy for the kids, everything set aside. I need to see my baby. And they were like, you're not seeing the baby. Then my anesthetist came and says, we need to put you on a ventilator. Remember, I was very active in COVID. People who have been on ventilators don't come off the ventilator. So why do you want to put me on a ventilator? That's as good as me dying.
So besides being ill, you now had COVID or what? Why?
No. So COVID made people think ventilators are only for COVID.
Oh yeah, that's what we thought.
Yeah. But a ventilator is just a machine which helps you to breathe when you can't, when your body is shut down. So ventilators have been there, but they were just not as common. And this also was during COVID time. I was tested for COVID, I think 3, 5, 10 times. But remember, in that time, you used to get tested for COVID before you got admitted. Then they were like, we need to put you on a ventilator. And so I'd had a colleague who had died in the very same room, very same scenario, gave birth, everything. So everything was now rushing in. She also got onto a ventilator, didn't make it. I had seen patients in our hospital dying on the ventilator. I knew what a ventilator meant. And I said, no. Let me just go naturally. I'm not going on a ventilator. And then my apostle and my pastor came and they came to see me. And he's also a doctor. So I think the doctor whispered that this girl is being stubborn. She does not want to go on the ventilator. And he spoke with me and everything and says, look, okay, what will make you, if we pray, we'll cover the machines. Would that make you go on the ventilator? And then I said, no. Then I started crying. And then I said, no. I don't want my kids to see me die that way. I don't want to die that way. Then he says, but Pada, you have to go. Remember, in my mind, I'm fine. And he's like, look. So he says, look at the stats. That's when I think reality started creeping in. And then he says, no, you're going on the ventilator. As your father, as your spiritual father, you are going onto the ventilator. And he says, we'll pray. And he didn't say like, sometimes we think miracles come in these big gestures of prayer. He just says, I'm praying, I'm covering this. Nothing's going to happen. You're going on the ventilator. He called the anesthetist. Then I said, are you sure? Then he says, I'm sure. Go on that ventilator. And then I said, fine, put me on it. This lady, I remember she had her purse. It's like she didn't wait. You could see she was like pacing because they didn't know what to do. And a physician had been called. I now had so many doctors who were coming in. Everyone was saying this girl has to go on a ventilator, but this girl's being stubborn. She's saying, I'm not going.
She's refusing.
So when it was said yes, she literally called that whole team back and they were not stopping. And, I will not forget her. She had a bag and she just threw her bag. They put the machines. This all happened. So my parents had come in. Remember, they'd had their family. By the time I think my parents got to their house, I was already on the ventilator. And I remember when they put me in there again, another time, I couldn't say anything. All I said, holy angels, watch over me. And that was it. I was out. And to me, I was like sleeping. So one day I would be sleeping this side. I would see my sister, like a vague of my sister.
Picture.
Then I would see a vague or some experience. Next thing I wake up, my hands are tied onto the bed. I have tubes everywhere. And there's this NSAID. All I know is I want water. Like, I'm asking, can I have water? And he's saying, you can't. The doctors are saying nothing. I was like, is this how hell is going to be like? You know that Bible verse which says, and then the rich man was asking for a drop. That's all I was asking. I was like, can I have a drop? And he was like, no. You're nil per oral, which means nothing. And then I was like, where am I? So he's a nurse that you could see was confused. So I think he called the nurse who came. And you could see the shock on people's faces. Paida! And I'm like, cool. I was sleeping. I'm awake. I want water. Then they call my husband. And then my husband comes with this paper and says, write what you want. And I'm thinking, right? I can speak. That's when I realized I can't speak. I can't, even writing, I can't, and I'm restrained. So I'm like, guys, what's happening? Again, in my mind, I'm vigorously saying this, but I'm saying it slowly. I'm feeling slurred. So apparently I couldn't speak because of all the tubes. So they had devised an idea that my husband printed out a letter which had the alphabet A to Z. So in my moments of conscious coherence, I would write out he would put it next to my hand and I would point at and spell out what I needed. And apparently all I spelled was, I want my dad. I said, Dad. I wanted my dad, my father. So now at least I think consciousness is now there. They've been slowly taking me off the sedation and everything else. So on this particular day is where I remember, but I had been in and out and lucid over a couple of days. But for me, on this day where I'm conscious and I see this NSAID and I want water, to me it's just a continuation of that
yesterday.
Of yesterday.
It's almost like you were sleeping yesterday.
I was sleeping yesterday and I was going through this dream and now I'm waking up.
And yet it had been days.
It had been weeks, Nyenge. I was under for 2 weeks.
You were out of it for 2 weeks?
2 weeks, but to me it was a day. It was literally a day. It's literally I've slept, I've woken up, but everyone around me is acting funny. So when I'm now, again, the next day is a bit blurry because I'm in and out of sedation. But when it now really hits me and I'm really fully awake, the first thing I'm like, so this NSAID comes back again. Because I think I asked for water for 2 days. And they were saying, Now in retrospect, I know they wanted to be 100% careful. They were being over careful because they wanted to make sure I was fine, because something like this had never happened before. Up to now, they do not know what happened to me. And so
they never found out what happened.
They never found out what happened to me. So finally, I can get water. I get water. I'm getting a bit lucid. Then I say I want to use the toilet. And then this nurse says, Paidamoyo pap. I'm like, no. Then the toilet. I'm like, Paida, you can't walk. That's when I realized I was paralyzed. So I was paralyzed. I didn't know. And then, me being me, I said, okay, let me step out. Only find out I can't. I have no control over my feet. I have no control over anything. And she was so happy that I said I wanted to use the loo. And then she says, what do you want to do? I say, number 2. Then she says, do it there. Then I realized I can't even do it. Then she's like, but do you feel like doing it? I said, yes. Then she calls the doctor and says, she feels like going to number 2. I'm like, why is it? So apparently those 2 weeks, my bowels were not moving. So they had put me on a drug to elicit that bowel movement. So this was to them a miracle that she wants to go to the toilet. Then they're like, do it there, but I couldn't. And then I said, someone has to tell me what's happening. Only then did my husband come and then explain the whole ordeal.
So it had been 2 weeks of you just under, without being
2 weeks being under, just thinking I'm sleeping. Nothing, no pain, no discomfort. I was in the most perfect sleep. I thoroughly enjoyed that sleep. But when I came out, everyone thought I was in pain. Everyone thought, my mom is a nurse. She kept on saying, I'm going to the pain, and a C-section, I got operation within the same phone. And I kept on saying to my mom, I'm okay. I don't have pain. When I was now lucid, everyone kept on saying, how? And that's where I realized there's a break in our healthcare system, because no one actually sat me down and told me what had happened. I had to discover it bit by bit by bit. Then I saw the file. I call it the file. It was this big file. That's when I realized how many doctors had come to see me. And in my mind,
how many doctors did come and see?
I think about 10. Because at some point, my heart, so I needed a cardiologist. I needed someone for the kidneys. My liver was in function. I had to go for an MRI. I had to do CT scans, MRI scans. They had to take me apparently from that room, put me on a mobile ventilator. It was drama, I tell you.
And all the time you are fast asleep and all these things are happening.
People, you guys had so much drama. I'm sorry, I was fast asleep. Nothing. So all the trauma that happened to my family, not to me. When I came out, you could see they were traumatized. And every time they would want to come and talk to me, I had to be there for them despite my own situation. And I think that is what God was trying to teach me, as someone was going to serve him later on, that sometimes you have to just forget your own problems, forget your own circumstance, and listen to the person God has put in front of you to help. So everyone kept on coming. I was sick. And remember, I can't walk. So I had to go through physio. And for me, it was humiliating that I had to go on myself. Everything. So they had to come and do those baths where they lift you up, move you. Sometimes it's a guy. They have to wipe you because you've... So my number one determination was to get out of hospital. So
Your child, you haven't been...
No, we managed to get later on. Remember, I was in ICU. From ICU, I went to HDU, and then I went to the general ward. When finally I was at the general ward after a week, they allowed my daughter to come, and, I cried, and I could see my daughter, and she didn't know me. She was crying. She didn't want me. That in itself was another experience. So I really wanted to walk. I just wanted to walk again. The physio kept on saying, let's do it slowly. I said, no, I can't. I need to get out of this place as fast as I can. So I determined myself to walk again, to write again. Remember, I was now paralyzed from hands and legs. So anything I needed to do, I'd need people to come and assist me, push me up. I remember the first day I managed, because when you're not doing that rehabilitation, the first thing you need to learn is to sit up, because you've been lying almost 2 weeks, and you sit up without feeling like you're falling over. You sit up, you celebrate. When I sat next to the side of the bed, another thing. When you're able to just stand up, another victory. When you're not able to sit in a chair, another victory. The day I managed to stand and do my first step, all the nurses came and they sang for me, because they said, we had said, you're gonna. we had said this one, the doctors had, my parents, they had those conferences with the parents so many times. I literally was now like every day, did she make it? Is she up? My family, my sisters, my brothers. And you know what, Nyengi, what was happening when I was sleeping? A whole movement of prayer was happening, which I only then found out afterwards, where people who don't know me from Canada, from Zambia, my church got a spirit of prayer revived in it. My siblings, everyone was praying because they were saying it does not make, for whatever reason, they were saying this does not make sense. I think, and what was not making sense was this was supposed to be a time where we're supposed to be celebrating there's a baby.
New birth, yeah.
And people always thought that the baby was the sick one. My baby was fine. I was blessed. I had a maid from heaven. My sister came all the way from Canada, took over my house as if
it was hers.
People just rallied
around.
My kids did not feel that mommy was not there. But what was happening? So it's like God was taking care of my kids in my house, but at the same time, my situation was igniting this movement of prayer. And before I'd gone under, he had told me that you need to start being a prayer warrior. I wasn't. I mean, some people can just say, I'm a prayer warrior. I wasn't necessarily one. But I had started this movement and believing that prayer can do so many things. And so remember, I don't have my phone. And I think I got my phone a month later when I was now reading the messages of people saying, when we're at university, you inspired me, Paida, you did this, I'm praying for you. Your situation has reminded me that prayer is alive. People sending prayers, saying candles. I was like, me? How? People who didn't know me, sending to my mom, sending to my husband. What I was told was when people heard about what was happening, whatever happened, people were tagged to pray. So it revived prayer. So people were praying. Ladies were coming to avenues because now my colleagues, like I said, I had the strong work family of doctors. I had doctors coming in. Each and every doctor wanted to say their opinion. They were banned because they were not filling up the whole place. They were banned. People were giving me pro bono coming. They don't know me. These are people who don't know me. And when I was now coming up, they'll come and then I remember, like, these are like doctors, those doctors who we know, they'll come and they'll say, we don't know what happened, but you've made me believe in God again. This does not make sense. Because everything was shutting down. Everything was haywire.
Like
only that I can't use the
down.
technical. If I use the technical terms, you'll be like, what? So just so that viewers understand, everything was just going wrong.
So in terms of like everything's just shutting down, like almost someone who's dying.
I was dying. They came to us, and then, my physician, my lead physician, I remember when I was now up, she says, I can go to the saloon now. She says, I couldn't even go. Her life has stopped. But what had happened to everyone who has testified and come back to me was it ignited prayer in them. It made them realize some things we are out of control, that God is in control. And I came back home. Everything was fine. But again, why I say I'm in therapy with God is because I was so eager to go back to being normal because of what I'd experienced, what had happened. I was in a rush to go back to work. I went back to work within the 3 months of my maternity leave. Even despite this, my physician had said, take 6 months. Don't go back to work. Take 6 months, And I said, no. Because now I was like, I have experienced what it is like to be a patient. I cannot wait to go and be the best doctor and help and take the experiences I've got to show people at work that when we can start a near patient, don't be rough. It's not nice. I wanted to show the nurses that I appreciate them. There was so much happening. So I went back to work. I went back to being normal, school run, everything. 2022, I was normal. You wouldn't know. I went back to church, took up my responsibilities as church. You would not think this is someone who has nearly lost her life. I told myself I'm not going to go ask God why, because I am a Christian. Why not me? So I forced myself to be okay, but I was not okay. I went back to school, my master's, re-engaged everything. I just literally went back to until one day I was at work, normal, ordinary day. I just started crying.
How long was this after you?
Almost a year. But I could tell something was not, but I was determined to be the
just
face.
pushing.
I was pushing. I was determined to be the ideal woman. That it has happened. I have to go back. I still have to be a mom. I still have to be a doctor. I still have to be a deaconess at church. I still have to be a wife. Okay, I almost died. Wah, wah. God performed a miracle. Let's go back. I just started crying. From nowhere, I cried and I could not stop. I couldn't find a reason. I couldn't find anything. And then that's when I realized I didn't grieve what happened. I didn't grieve the almost losing my life. I didn't face the reality. I didn't face the facts that I almost died. I almost left my kids. I almost didn't see them. And I didn't face the fact that I felt that God had, why did this happen? Asking the why is not a bad thing. It's what you do after that.
Yeah.
You say, God, why? But
how you
why
move
not me? How you move from there. You don't dwell in it. You're not proud and saying, because I did do this. I said, no. So I had to start going through the giving process. And a lot of things that happened in 2022, 2023. Mentally, it was part of the most challenging time of my life, where I had to face God was reflecting who I am, my purpose now. So you see, some people find purpose in these near-death experiences, but my purpose was already there. This experience was to show me, to say you're neglecting your purpose. You know your purpose, Paida, but you're not doing it. But I do not want you to go through your purpose the way you are right now. There are certain things in you we have to change. So that's where the therapy came. And they say when God is your therapist, it's a hard one. So it's been a journey of him. God knows exactly what to tweak and exactly what to take out. A humbling experience, going back to who God is, going back to who Christ is. And I think I needed that rest for him to show me. I call it rest. I don't say I was in ICU. I say it was a rest because it showed me what one person can do, what I can do. There's something in me that he has placed, which is not just for me. It's
to serve other people.
It's to serve other people. It's for the greater glory. So all the lessons I learned through that is just to say it's all about Jesus, and miracles still do happen. Miracles do happen, and prayer absolutely works. So that's why I'm doing therapy.
Oh my gosh, that is like so amazing. I'm thinking, when you were saying before you wanted to go and sleep in that room, and this is what God had already started speaking to you without you realizing that you were talking about sleeping to go and rest, but he was actually going to put you through that sleep. To get you to get a movement going on.
Yeah.
So Dr. Pai, I know, your 30-something odd years.
Yeah.
So many other things have happened.
Yeah.
But I truly believe that, I always say that, God has a way of making things work his way, especially when he's trying to move you into a certain direction.
Exactly.
Tell me about those lessons. Can you give me the life lessons from 2021 to now, your life lessons?
Put Jesus at the center of it. I say Jesus purposely because that's where salvation and redemption comes in. It's so easy to put God because he's a father. Put Jesus around it because when I woke up, that's the only thing I actually remember. And that's the only thing I'm conscious of. I say to my husband, it's all about Jesus. So I've been on a quest and search for Jesus. Who Jesus is, what does Jesus bring? And I think it's essential for Jesus because he was the human form of God. So he shows us how to move, how to walk in this earth. Because God is a Godhead. So we can never really be like him. But when it comes to Jesus, he teaches us, he shows us how to be a leader, how to love when people are against you, how to be patient, how to fight the enemy. So for me, it's been put Jesus at the center. We always sing it and we say it, but seek Jesus and seek who he is. And I think life will be better. And a lot of the questions and the doubts we have will be made clear. Another thing is, why not you? Who promised you a good life? The Bible says we'll face trials and tribulations, but what I now know is when we say he will never leave you or forsake you, it's true. I know angels were with me in that room and they were just saying, do what you want to her. but we are here. She's going to come out of this. So for me now, when things come, challenges come, I say, why not me? Because it was so easy for me to say, but I serve you. I give tithe. I'm a deaconess. I do this. Why me? Why did you allow this bad thing to happen to me? Why not? In our struggles, that's where he shows his power. Because at that time, my doctorate had nothing. All the people who are learned couldn't help me. It was just a time for God to do his will and to use me as a vessel. Another thing I've learned is if you have a purpose, do not be shy about it. I think for the longest I was shy. That I can do this ministry thing. I can serve. I am called to serve. Because I thought it was pride. I thought it was putting myself up. But if you are called, you are called. You cannot run away from it. So just accept your purpose. You don't need to almost die for me to come and say, okay, God, I've heard you loud and clearly. Yeah. So serve your purpose. And if you're in pain, find purpose in your pain. And as women, we need to stop abusing each other and telling us, get over it, pray. Healing is not a one-day thing. I'm still healing from my own. Healing is every single day's healing. And we need to celebrate this. Every step of healing, we need to hold hands. I need to be able to call you Nyenge and say, Nyenge, today I smiled. Today was a good day. Healing is not go and pray. We really need to stop saying those statements to each other and understand that healing is a day-by-day process. And we need to just be there for each other. And at the end of it, it's not about us. It's about the one we serve.
Exactly.
Yeah.
Exactly. Yeah. Oh, wow, Dr. Pai. Oh, my God, I could spend the whole afternoon and have all these other questions.
I know.
And you know, and the one thing that I just want to know that with all this, two things actually, not one. How has it changed your role as a mother and as a wife?
I'm intentional now. I am so grateful for my husband. He held. So it has kind of made me break down those roles that a man is, because he was the mom. He had to feed the baby, take off the diaper. He had to come and see me. He had to do the school run. He had to do everything. So I now know it's teamwork. We're in this together. I'm now intentional because I can die. I mean, death is inevitable. I almost did. So now when I look at my kids, I'm grateful. And it's made me very grateful to God. So I always say to them, let's thank God for anything, any random thing. Let's thank God because I'm grateful I've been given the opportunity to be with my kids, to see them grow. So I'm intentional. Am I perfect? Am I grateful every day? No. Sometimes, yes, they irritate me. But I'm now very intentional. I try to strike a balance without spoiling them. But to be a mom who is there, who is present. And a partner to my husband who's there, who's present. Who I'm now more supportive of him because he truly was 100% there for me. So that has changed. I'm now more great. I found there is peace in being grateful for every single. I'm grateful for when I talk to you. When I talk to you and I say, Nyenge, help. I'm grateful that I have someone I can go to and speak to because not everyone has that. So I think I'm grateful for the grace that God has given me to be able to look into my children's eyes, to be able to do school run, to be able to have those fights with them. I'm eternally grateful.
Oh, wow.
Yeah.
And if you look at, with all you've gone through, what would you say to an 18-year-old Paida right now?
You mean more than you think. You know, you're confident in everything, but you always have this little girl who's yearning, am I seen, am I heard? I would say you're heard. Take it easy. The world might not hear you, but there's a God who hears you. So take it easy.
Amen.
Take it easy.
Oh, wow.
Dr.
Pai is so powerful. Oh my gosh. I'm just in awe. And you know, just the way God has worked in your life, you know, the prayer bands. I mean, I was a part of another group of ladies who were... You see,
I didn't know that one. For me is mind-blowing.
But what you then just said about, I didn't know about all the other ones now that you just said, but just the power of prayer. I think sometimes we forget when we are praying, because you think, what would my little one prayer maybe make a difference?
Yeah.
But I guess a community, a whole band of people praying, and I think sometimes as Christians, like you're saying, that we think these prayers have to be big and long and loud, and but just the simple prayers you were saying while you were in.
You know what? I know we're running out of time, but the Apostle Paul says, the only thing I'm proud of is I have served God with integrity and a godly sincerity. That's another lesson I learned, that when your prayer and your serving ministry is out of integrity and sincerity, it doesn't matter how it looks to the rest of the world. God looks at the heart. So our serving manifests, our prayers manifest differently. You will serve through this platform. I will serve. Now I know, and I will confidently say, I'm called to serve women by igniting and prayer, by creating an environment of prayer for women. Someone else will be on the pulpit. Someone else will be by just cleaning houses. How our servitude and our apostleship, our discipleship manifests differs. And we should always know and be proud of how God has gifted us to manifest it, and not look at how it's manifesting for the next person and then look down on ourselves that, I'm not contributing anything to the body. You are. It's just that the way you are doing it manifests so differently. So the question, the journey is to find how it is, own it, hone it in, improve it. You don't even need an audience. If it means I'm just going to do it for one woman, then my work is done. So for me, it's mind-blowing. My husband's work, prayers, everywhere, prayers. So it had to go through this way, but I'm here.
Wow. Oh, it's powerful. All right, just to lighten the mood, we're going to have few fun questions. I mean, it's like my mind is boggled. I have so many questions, and I'm praying that we've made a difference in people's lives by today's show. So I'm going to ask you just a few fun questions. What's your favorite color and why?
Yellow. I love from a young, I don't even know why. From a young, when I was a young girl, I just love it. I just like looking at it. It makes me feel happy. So yellow.
I know. Like, you're like, hey, I love yellow because it makes me happy. I think it's such a sunny, happy color.
Yeah, exactly. Sunny,
Yeah. What's your favorite animal and why?
Dogs. And I will say, if my sisters and family are watching, dogs. I love dogs.
You love dogs. How many do you have?
Right now I only have one because someone poisoned my dogs. Long story. But my dream is to have 5 dogs. I love them because dogs, they've taught me a lot. They're loyal. They're kind. They feed off. Dogs. Hands down.
Wow.
Dogs.
What are you reading currently?
I'm reading a book called Elijah, Anointed but Stressed. It's an old book I got from my mom. She was clearing out her library and she gave me a bunch of books and then I saw it. So it's called Elijah, Anointed but Stressed. It talks about how, although Elijah was anointed, there were times he was scared. Remember, he ran away from Jezebel. He ran away from one person, despite even having faced the prophets of Baal. He ran away from one person. So it's a very interesting, it's by this guy called Jeff Lucas. I like the way he writes it. He's writing it from the perspective of what was happening, the context in that time, perspective of Elijah, and now brings it to us. And I think I'm a kind of an Elijah as well, where, God says, Elijah, why are you hiding? So it's like, Paida, why are you hiding?
And there you are now.
And there I am. And it's this old book. You see, it's brown. And my mom had it for this past, and that's the one I'm reading.
Oh, wow. That's so precious. What's your favorite movie of all time?
I'm not a movie person because I always fall asleep at the beginning of movies. So I'm not a movie person. It'll be very hard. I'm not a movie person. That one is a very hard question. I hardly can finish movies. If I want to fall asleep, I actually put on a movie.
Wow.
That's it has this, it calms me and makes me sleep.
It's a soothing
It's
sound.
soothing. When I go to the stay clinic with my kids, I fall asleep and then I have to nudge me and say, Mom, it's time to wake up. So
movie. What were you playing in your car on your way here?
Janet Manure. I've played Janet Manure I'm a person of habit, creature of habit. I have had her albums since my husband says when I was under, I used to play her music for her. When I came back up, he had gone to her and she had signed the DVDs. So it was like he was saying it's a present for me when I came to. So Jeremanywa 3 and 3.
Oh wow.
I bought the flash with all the questions.
Fantastic. We're packing our bags. We're going to the airport. Where are we flying to?
A place where we can do an expedition of tea. I love tea.
Seriously?
Yes. So I don't know if such a place exists. Like where we can have a tea.
Different types of tea.
Like every day I'm tea tasting.
Wow.
We're taking different teas and then someone is explaining how this one is made, where it's from. So in my mind, it's somewhere where it's in the jungle, no internet, no, you know, those things where we're sleeping indoors, outside. I don't know if there's a place called like that, but
we'll find a place.
Yes.
We'll find a place.
If there's someone who knows that should let us happen, then we take our bags and go.
So if there's anyone out there in our audience who knows, please tell us.
Yes.
So Dr. Pai can go.
Yeah.
Dr. Pai, thank you so much for your time.
Thank you so much for inviting me.
For opening up your heart and, you know, for just helping 1, 2 people out there.
I hope so. That
with
one,
your story
that one
and
woman, yeah.
many, you know, and I mean, that's the whole idea of this platform that I just pray and hope that as people listen to people's stories, they learn, they're transformed, they're inspired, you know, just, or they heal, you know. I'm just praying that with each one story that, you know, you get to learn something. So thank you for your time. And to our audience, thank you so much again for your time. And I pray that you're just going into the new week, that you are inspired, that you remember to pray and you remember the power of prayer. Thank you and see you next time.